Hi again, Sarah. Thank you for volunteering your time with me once again. Today we're going to be doing the bedside swallow assessment as well as a bolus trials. We're just going to start with a lot of questions for you, just about your day-to-day eating, swallowing, moving habits. So we're going to start with, are you able to feed yourself independently?
Yes.
Okay. And are you moving around independently? You are not on a ventilator. No. You seem quite alert to me. And are you ready to cooperate, mostly?
Yes.
Aware of any difficulties you might have? Yes, and if not, then we'll figure it out. Posture when you're sitting, how do you feel that is?
It's not that great.
So it's okay. Able to get out of bed.
Yeah.
And you can consume more than half of a meal, or at least a half a meal.
Yeah.
You're able to brush and clean your own mouth out. Yes. Lethargic. No. You're not uncooperative. And you'd be aware if there were any difficulties. So, do you have any problems with thicker foods more than liquids?
No.
Okay. And do you have any issues with thicker foods or liquids more than thicker foods?
No.
Okay. Do you have any issues swallowing pills?
No.
Okay. Do you ever get a lump in your throat or pain when you swallow? Any gurgly or wet sounds after swallowing when you're voicing?
No.
Okay. Any increased phlegm or mucus after swallowing? Any reported pocketing in the side of your cheeks? Food left in there? Okay. Any indigestion or heartburn?
Yes.
A little bit. Acid reflux. Do you ever have choking or coughing while you're eating or drinking?
No.
And let's see. Any runny nose after eating, liquid reflux through your nose?
No.
Any acid or metallic taste upon waking?
No.
Does it take you a long time to eat?
Yes.
Any throat clearing after swallowing? A little bit.
A little bit.
Any dry mouth?
No.
So you would say these swallowing problems occur infrequently?
Yes.
Okay. During any specific meal times?
No.
Any certain part of the day?
No.
And since this is so infrequent, I'm not going to say it's been happening for any extended period of time. Or that it happens suddenly or gradually, because they're just infrequent cases for you. Is there any food that's easier to swallow for you? Any foods that are more difficult for you?
No.
Okay, dear. We'll move on. You are on a regular diet, to my understanding. Any abnormalities? Let's see. You're not missing any teeth. Can you smile for me? No dentures? You have your natural upper and lower teeth?
Yes.
Okay. Are you aware of any cavities you have?
No.
And we just decided that we don't have dentures. Any inflammation in the gum area?
No.
And again, we're not missing any teeth. We don't have any decayed teeth. All right. We're very aware. We have control of our secretions. You don't have any trouble with drooling or wet breath sounds. So that's a no on both of those. Now for a moment, Sarah, we're going to assess your jaw function. So I'm going to ask you to open and close your jaw. Perfect. Now I'm going to ask you to open your mouth as wide as possible for me. And raise. Perfect. Now move your jaw from left to right for me. Lovely. Now, open your jaw against my hand. You did great. And then I'm going to ask you to open and close your mouth as quickly as you possibly can. So, perfect. Now for this section, Sarah, we're going to be just checking out your lip function. So, at rest, they seem to form closure. So I'll put a big check mark there. And then if you'll smile for me with your teeth. All of our teeth are there and muscles are moving appropriately. Now I'm going to ask you to round your lips and make the ooh sound for me. Very nice. Now smack your lips together for me. Beautiful. All right, now I'm going to ask you to say pa, pa, pa as fast as you can. Are you ready?
Mm-hmm.
Set, go.
Pa, 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 pa.
Stop. Perfect. Now, we're going to need the tongue depressor to do this next portion. It's sterile for us. I'm using my gloved hand this time. So what I'm going to do is I'm going to put the tongue depressor between your closed lips, and then I'm going to try to pull it out. And you're going to try to hold it in, okay?
Okay.
Ready, go. That was great. You did good. Now I'm going to ask you to puff out your cheeks for me. Perfect. Now, do a kissy face for me. Lovely. Now, this one's a bit tougher. This is the pucker, smile, pucker, smile. You're going to do that for a couple sets, and I'm going to just make sure that everything is moving the way it should be. You ready?
Mm-hmm.
Go. Again, for me, sweets. Lovely, lovely, Sarah. You did great. All right, now for this, I'm just going to touch areas of your lips, and you tell me if anything feels sensitive or painful. Okay, nothing feels out of the ordinary. We're moving on, Sarah. We're moving right on through. All right, now I'm going to ask you to stick out your tongue, fully extend it for me. Perfect. Now I'm going to ask you to lick your lips all the way around. Did a great job. We'll get you some chapstick after this. Can I get you to do a little left to right action with your tongue? Perfect, perfect. All right. We're going to move on to the, I'm going to ask you to open your mouth and put the tip of your tongue behind the bottom of your teeth. Now put it on the top. Now try to reach your chin with your tongue. Now try to reach your nose with your tongue. Great, great, great. I'm ask you to open your mouth wide and say ka, ka, ka for me.
Ka, ka, ka.
That elevation is what we're looking for. Now we're going to do ta, ta, ta.
Ta, ta, ta.
Now, pull your tongue as far as you can back in your mouth with it wide open. Good, good. Now we're going to be using that tongue depressor again over here. I am going to ask you.
I can't do that on your Apple Watch.
Well, goodness, Apple Watch wants to pay attention too. I'm going to ask you to push the tip of your tongue against the tongue depressor. Good. Now the right. You can push. Extended now left. You're doing great. Absolutely awesome, Sarah. Thank you. Now I'm going to ask you to push on the side of your cheek. Other side of your cheek with your tongue. All is functioning lovely. Okay. Now we're going to do a tongue sensitivity portion of this test. So I'm going to ask you to stick your tongue all the way out. And then I'm going to touch parts of your tongue and you just let me know if you feel them or not, okay? Great. All the sections of your tongue seem to be responsive. And that is exactly what we're looking for. So now we're going to be checking your soft palate, which is just the back portion of the top of your mouth. I'm just going to ask you to open wide for me so I can observe the inside. I'm going to position these lights on as well. Perfect. Okay. So at rest, everything looks typical. I'm going to ask you to say ah so I can notice the elevation. Now we're going to do that again. Give me a pause in between the ahs. I'm going to ask you to say it 3 times. Ah, 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 but with your mouth open. That was excellent, Sarah. Thank you. Now I'm going to test your gag reflex. If you can just give me a wide open really quick. Yep, you got it. Gag reflex. Wanted to get that one out of the way quick. Your resonance through this entire exam has been excellent, which is just the quality of your voice sound. Now we're going to be checking your facial symmetry. So everything at rest looks typical. If you don't mind taking off your glasses for this portion for just a moment. Puff out your cheeks for me. Hold that air in there. Excellent. Moving right along. Now we're going to check the inside of your mouth. Open again. No access. Moist, but it's not dry. No excess phlegm. Thick mucus. Okay. You don't have a tracheostomy tube. No. Your vocal quality is normal. No throat clearing or persistent cough. You have noticeable voice control. You can tell when you're being too loud. Now for this next segment, we're just going to see how many seconds you can do the ah sound for me. Are you ready?
Mm-hmm.
Set, go. All right, that was excellent. Now, we have no identifying predictors of pneumonia or aspiration, so we're just going to move through this next section onto our Bolus trials. So for this section, Sarah, I'm going to be asking you to eat and drink a few different things, and just assessing the rate in which you swallow, how many swallows you may have. You can put your glasses back on for this. So let's start with the beverage that I have right for us is a Capri Sun. First, I'm going to ask you to drink out of it with just the rim of the cup. So take a drink for me. And I'm going to touch your neck while you do this. Beautiful. Now, Sarah, if you wouldn't mind, I would love for you to use this straw so I can see your closure on your lips for that as well. I'm also going to fill your throat. Perfect, Sarah. That was lovely. All right. So it seemed everything was appropriate with that one. We're going to move on to our puree substance. That is going to be applesauce for us today. So you have applesauce and a spoon for you. Now if you could just take a bite of that. Maybe a bit bigger than that. That's A-okay. We just want to make sure that we're getting all of it. So go ahead and take a bite for me. You don't like it? Swallow. So sorry. We are almost done, I promise. All right, sweet girls. So now we're going to move on to the bagel. So hopefully that one's better for you. This is just going to be our soft mechanical. And I'll just break off a piece of the bagel for you. Oh, it's a little much. The dry foods are harder. All right, now swallow. I know. Open your mouth for me. Stick your tongue all the way out. So there is some residue from this, but that is typical with dry foods. So,
Can I take a drink?
absolutely, please take a drink. Now, lastly, we're going to be trying a solid and regular food, which for us today is going to be pretzels. So, this is for you. You just want to select a pretzel for yourself. Now swallow for me when you can. All right, now open. Nah, don't clean up. You gotta stick your tongue out. Thank you. I know it's tempting. All right, dear. So we've gone through all these trials. I would still say that your risk of aspirating with these foods is low. So I would recommend still a regular diet for you. So regular food solids are fine for you. I would recommend sitting at approximately 90 degrees when eating. That would help. Hard swallows might be helpful with getting down dry food like bagels or pretzels. Other than that, I have nothing else to recommend to you. Your lips, tongue, mandible are full functioning. Thank you for your time, Sarah.